So, good afternoon. My name is Tim Gibbs with the Delaware Academy of Medicine and Delaware Health Force. Glad to have you all here for summer session of Delaware Mini Medical School. We do this in partnership with Bay Health, BB Healthcare, Christiana Care, Nemours Children's Health, and TidalHealth. And very grateful for their partnership. So we started off last week with Bay Health, and this week we're with BB Healthcare. And
Today we're with TidalHealth.
Excuse me, TidalHealth today. I'm sorry, that was done in alphabetical order. My bad. With TidalHealth. Just to remind, there are no tests or grades for Delaware MiniMed. You do need to stay until the end of the presentation, and today that is absolutely going to be at or before 1 o'clock. We have a very active practicing surgeon who's actually getting out of surgery right now, and she will be going right back in. So we will not be able to address everybody's questions, unfortunately, today if we go over as we did last week. All the sessions and presentations are available at delawareminimed.org. Today's session will probably get posted sometime tomorrow evening, along with the PDF of the PowerPoint presentation. If you've got any questions, please contact my colleague who's on the screen with us, Nicole Sabine. There's her email address. So yes, indeed, neurosurgery, TidalHealth. So it's interesting. Last week we did behavioral health, and some of the questions that we had were around what's behavioral, what's psychiatric, what's psychology, what is, a hardwired condition. So this should be a great follow-up. And I'll go ahead and do an introduction for our keynote speaker, Dr. Sophia Shakur is a board-certified neurological surgery and neuroendovascular surgery. She provides brain surgery and spinal surgeries and specializes in stroke and brain aneurysms. She was born in Calgary, Canada, and grew up in Salisbury, Maryland. She completed her undergraduate studies in molecular and cellular biology at Johns Hopkins University in Baltimore, Maryland, and she earned her medical degree from Johns Hopkins University School of Medicine. Dr. Shakur completed her residency in neurosurgery at the University of Chicago in Chicago, Illinois. She also completed a neuroendovascular surgery fellowship and a cerebrovascular surgery fellowship at the University of Illinois at Chicago. Her clinical interests are cerebrovascular and endovascular neurosurgery. She was awarded the Louise Eisenhart Award in 2014 and 2016 by the American Association of Neurological Surgeons, and the Sherry Apple Award in 2015 by the Congress of Neurological Surgeons. Now, importantly, Dr. Shakur volunteered in a surgery waiting area at the TidalHealth Peninsula Regional while attending high school, and I'm going to turn it over to our colleague from TidalHealth, and she can tell you more about the volunteer experience. Over to you.
Good morning. My name is Kelly Novak, and I'm the Community Engagement and Volunteer Manager for TidalHealth. And I am not Dr. Shakur. She is coming. She is finishing up a surgery. She is a very active surgeon, and we're very excited that she can be part of the presentation today. So I appreciate your patience and realize that she is on her way. And at any point, if you were in surgery, you would not want her to be rushing to come out to do a presentation either. So I'm going to tell you right now, I am nothing medical, but I have seen her PowerPoint multiple times, and it is, if you are medical, you're going to like gross things, and this is incredibly gross. You're going to see the inside of the brain with some of the videos that she has. So I'm excited for you to share. I'm excited for the opportunities that I hope this provides you. I hope that you see that in 20 years that you could be a surgeon as well, and you could be doing this. When she was a young person volunteering in the same-day surgery area, and then going to college, and then coming back to Salisbury, to the peninsula to help her community out. So it's an opportunity to grow. and you can be what you can see. And so around you, as you look at all of the medical professions that you see over the next 6 weeks, realize that you can be what you can see. Never let anyone put a doubt in that. So I want to thank you all for joining, and we're going to hope Dr. Shakura arrives very soon. If not, we'll start looking at what her OR looks like. And I'm gonna maybe share my screen. And so we can get started, and you can just see what her OR area looks like. Here we go. Okay, share. Okay, so you should be able to see that. So pretty in-depth OR area that she has there with the table. You're looking at a brain area, so you've got to have, she's not cutting a lot open, so you have to have the radiology and the huge TV and monitor in there so that she can see where she's going, what she's doing as she's progressing with that surgery that's through the monitor system there. Now, any initial questions you have before we get into Dr. Shakura? We're still waiting. I saw a couple questions in there. Tim, is there anything?
Nicole, are anything clinical questions yet?
Nope, one was just attendance related.
Okay.
Well, so one question that we can ask you is if any of the people who are on the call are relatively close by to your location, or not for that matter, how would they go about becoming a volunteer at Tidal?
Well, you could definitely go to our TidalHealth website at tidalhealth.org. Under community, there's how to be a volunteer, and you can click on that, and it gives all the information on how to become a volunteer here at TidalHealth. We have a very robust summer teen program. We had over 135 applications, with 120 completing orientation. And we just had the numbers of 113 students that are actively volunteering right now at TidalHealth in both Seaford, Delaware, Salisbury, Maryland, and Crisfield, Maryland. So they are all over the peninsula, seeing a lot of different things, helping their community, helping their neighbors, being and making impact everywhere that they go. It's a great opportunity. They've done almost over 2,000 hours just in 3 weeks. So I'm incredibly proud of the young people that are giving back to our community through TidalHealth, because they're not giving necessarily back to the hospital, any hospital that you're in, you're giving back to your community. It's really just using TidalHealth to use that conduit to give back. So, yeah. So that's where we're at. And so please reach out. Our volunteer coordinator, Audrey Bryce, is a great resource for you. She can direct you in a lot of different ways. I'm just gonna see where we're going here. Any other questions that they have?
Nope, that was it for right now.
Okay. Well, again, apologies, but you definitely want a surgeon that's busy. There she is. So, all right, I'm gonna hand it over to Dr. Shakur and get you all set here.
All good. Okay. Oh, yeah, I see myself.
Hello.
Hey.
Hello, Dr. Shakura. Welcome. You have been introduced. The floor is yours.
All right, thank you. All the kids and students have been waiting patiently. So, this talk, even though I'm a little late, we'll still have a little time. It's that.
Same, we're getting in the right spot.
We still have plenty of time. So if anybody has questions while I'm talking, or you can save them till the end.
There you go.
We'll have plenty of time for questions. So yeah, we're going to talk about, I think, what's probably the most interesting subject, which is brain surgery. I'm one of the neurosurgeons, one of the brain surgeons at TidalHealth. We do all of our surgeries in Salisbury. But Tidal Health is a big system now. So we have Nanacoke and Atlantic General Hospital near Ocean City. But all of the patients who need brain surgery will come here to Salisbury. So we're going to talk a little bit about neurosurgery and the brain. So some objectives and goals for this talk. We'll try to keep it a little simple and clear. So first thing is, what is the brain? And then we'll talk about brain anatomy and how it's organized, and then some of the diseases or problems that can happen with the brain. And then if somebody has a problem or a disease of the brain, how do we identify and diagnose the problem? And then lastly, we're gonna talk a little bit about brain surgery and how you use surgery to fix some of these problems. So yeah, this is a picture of the brain. And it's a very unique organ. It kind of looks very different from other organs in the body. But let's see if this does the cursor work or
Yep, it
um
keeps disappearing. There it is.
okay, good. So yeah, the brain has lobes. So if you see, this is one of the frontal lobes that I'm outlining, and then another frontal lobe, and then, there are other lobes with different names, and then other parts of the brain include, it's got gyri, which are sort of these wrinkled areas. And then in between the gyri are the sulci, which are these spaces, these wrinkled spaces in the brain. So that's kind of an overview of what the brain looks like. So this is an actual picture of the human brain. And like I said, it's one of the organs in the body, a very special organ because it really makes each of us who we are. It is responsible for our thinking. It's what makes us talk and walk. All of our memories are stored in the brain. And really each of our personalities, the brain is what makes, me different from you and your friends. And the brain is another interesting fact about the brain, in terms of it as an organ, is that most of the cardiac output, so, when the heart is pumping blood throughout the body, even though the brain isn't necessarily the largest organ, it still receives most of the blood flow and oxygen. It's, the organ that uses the most energy. Because you can imagine with all of those functions, it requires a lot of energy. This picture shows, some basic brain anatomy. So like I said, there are different lobes or parts of the brain. And like other parts of the body, each part plays a special role or a special function. So, here in the front is what we call the frontal lobe. And in most people, the frontal lobe is responsible a little bit for our personality, our temperament, and then speech, especially Broca's area, can be located in the inferior frontal lobe. So we'll talk about speech a little bit more later, but Broca's area in particular functions in terms of speech output. In other words, how do we actually make our words come out correctly? That's what Broca's area, what that part functions in. Whereas, there's another speech area which is in the temporal lobe, which is here off to the side, sort of near the ears. But that's the temporal lobe. And there's another speech area called Wernicke's area, which functions in the comprehension or the understanding of speech. So yes, different parts of the brain have very special functions and interesting functions. There's the parietal lobe, which has some sensory areas in the brain. There's the occipital lobe at the back of the brain, which functions in vision. And then there's the cerebellum, which is at the back, at the bottom and back of the head, which functions mostly with balance and coordination. And then the very primitive or basic part of the brain is the brain stem, which is at the bottom of the brain, the bottom of the head, and the sort of in the middle. And that has very special functions too, very basic functions, controls our heart rate, uh, controls consciousness, our eye movements, facial sensation and movement. So it's all of these parts of the brain work together to make all of us work and think and walk and talk. So certainly a very interesting and complicated organ. Another interesting part of the brain is how it's organized. So, just like in the other picture, in the other slide, we kind of saw what different lobes do. There's something called the homunculus, which really means little human. So, on the cortex or on the surface of the brain, you can actually draw a little human. For example, your face, your mouth, your hand, your leg. And that is exactly how the brain is organized. So, for instance, if you look at the motor cortex or the sensory cortex in the brain, the leg part, the part of the brain that senses feeling in the leg is located more towards the middle or medial part. And then as you go out to your arm and hand, you go out laterally on the surface of the brain, and then your face is out even more lateral. So, and this is pretty consistent between, different people. So it's just very interesting how all of this evolved and how our brains are organized in terms of function, especially movement and sensation. Okay, so we've talked a little bit about brain anatomy and what the different parts of the brain are and what they do. So this next part talks a little bit about brain diseases or brain problems. So unfortunately, a lot of things can happen to the brain, which are not normal. So this is just a partial list of some of these diseases or problems that can happen. So the first is a stroke. So, what is a stroke? So a stroke is a sudden injury to the brain. And usually it's from a problem with a blood vessel or an artery in the brain. In other words, somebody with a stroke might have an artery in the brain that suddenly gets blocked. And so that part of the brain that's not getting blood flow or oxygen gets injured. And we call that a stroke. And then in other cases, the blood vessel or the artery itself can actually bleed. And then you end up with a bleeding or a hemorrhagic type of stroke. And certainly if you have a bleed in the brain, then that particular part of the brain can be injured. So that's what a stroke is. So that's, one of the more common problems that can happen with the brain. The other, of course, is trauma. So if somebody is in an accident or they fall and hit their head, that can cause trauma or, physical injury to the brain. And one of the, common forms or signs of trauma in the brain is called a subdural hematoma, which we'll see a little bit later. And then, there can be tumors in the brain that start in the brain and grow and cause problems. So I've listed a few famous people, who have been affected by brain diseases. So, some of you might remember Senator Ted Kennedy and Senator John McCain, and they both ended up having cancerous brain tumors. And then, there's Michael J. Fox, from Back to the Future. I don't know if this generation knows Back to the Future, but, he's been dealing with what we call Parkinson's disease for a lot of his life. So Parkinson's disease falls under the category of degenerative or motor diseases. So, he's got a tremor, and there are different surgeries and medications that people sometimes take for Parkinson's. And then, some people can have an aneurysm in the brain. So an aneurysm is a bulge on an artery, and that bulge can sometimes burst and bleed. So, maybe this generation is more familiar with Game of Thrones. So there's Emilia Clarke, who had one ruptured aneurysm treated, and then she was found to have a second one that had not yet bled. So she had that one treated before it could bleed. And then there's something called hydrocephalus, which is water on the brain. And if there's an abnormality in how the fluid is absorbed, it can cause some difficulties. So Billy Joel, the singer, was recently diagnosed with hydrocephalus. So this is a partial list of some of the problems that can happen to the brain. So if we suspect that somebody has a problem or a brain disease, how do we figure that out? How do we make that diagnosis and detect that there's a problem in the brain? Well, one of the main things that, most doctors rely on is the physical exam. In other words, you are going to, physically look at the patient and do different tests and see if there are any signs of a problem with the brain. So, just like we talked about before, brain function and brain anatomy has to do with movement, sensation, speech, balance, vision. So those are the parts of the physical exam that you're going to focus on. So if you see a patient at the hospital, or if you see a patient in your office, you're going to test their strength. You're going to ask them to move their arms. You're going to test their sensation, if they can feel when you're touching. You're going to test their speech, if they can have a normal conversation, or if you ask them to name different objects, can they name the objects correctly? You can test their walking, their vision, and how awake and alert they are. So all of these tests that you can do on a physical exam will clue you in terms of what their brain function is. And if you detect a problem, then your hypothesis is that, well, maybe this person has a brain disease or a brain problem. The other thing that neurosurgeons and brain surgeons rely on a lot in order to figure out what the problem is imaging. So, we use not just the physical exam, but also imaging studies, which you would have to do at either a hospital or an imaging center where they can do different types of imaging. So the first type of imaging is called a CT scan. It stands for computed tomography scan, CT scan for short. But, in order to get this image, the machine, it's a special X-ray machine. So it is X-ray based. So there is some X-ray exposure to the patient. And the way they do it is it ends up with a picture of the head that looks like this. So it's a black and white image. This particular scan is a CT head scan. So this bright white around the head is the skull, so the bone. And then, this darker gray area is the brain, the gray matter and the white matter of the brain. This dark black area in the middle is fluid, spinal fluid, cerebrospinal fluid, CSF in the brain, which is normal. But what's not normal on this particular scan is this other white area that looks sort of like a crescent or a moon shape. And that's what we call a subdural hematoma. It's a bleed in the brain, probably happened from some sort of traumatic injury. But again, if a patient comes to the hospital and they can't, move their arm, or they're having trouble walking or talking, after you examine them, you're going to get a CT head scan, and immediately you're going to see what the problem is, just based on the image. Now, besides a CT head scan, there is something called an MRI, which is another imaging modality or type of imaging that we have available to us. And an MRI, is not X-ray based, so there's no X-ray exposure to the patient. And it provides a little bit more detail, just looking at this picture, there's a little bit more detail in terms of the tissue compared to the CT scan that we saw in the last picture. But MRI stands for magnetic resonance imaging. So there's a special magnet that the patient goes into in order to get this picture. And some of you might have had an MRI at some point, but it's kind of loud, and the scan takes longer than a CT scan. But on this particular picture, this bright white area, this large white area, is actually a brain tumor. And in one of the videos that I'm going to show you later, I'm going to show you the surgery that I did to remove this tumor. And this was that patient's MRI. So this is a fairly large tumor. This is actually a benign tumor, so not a cancerous tumor. It's called a meningioma because it arises from the meninges of the brain, which are the covering of the brain. Just like meningitis is an infection in the brain, so meningioma is a growth or a type of benign tumor that can happen in the brain, but it's easily diagnosed with an MRI. And then one of the other imaging studies that we rely on is called an angiogram. So just like the name implies, it's a picture of blood vessels. So this is a pretty cool picture of the arteries in the brain, a very clear picture that the computer that's connected to the machine, it does a reconstruction with software, and it gives us a very nice picture of the blood vessels in the brain. So this particular study is used if we want to look at a blood vessel problem, for example, an aneurysm. So you see this brain aneurysm, again, an outpouching from an artery, which can sometimes bleed. And I'm going to show you the video of the surgery that we did to treat this aneurysm a little bit later. So those are some of the main imaging studies and diagnostic strategies that we use to figure out what's wrong with a patient's brain, if they come to the hospital or the office. So, this last part, we're going to show you we're going to talk a little bit about what's involved with brain surgery. Hopefully some of you will be inspired and interested enough to pursue this career as well. But it's a very fulfilling career. It's always exciting and interesting. So we're going to talk a little bit about what it's like to be a brain surgeon or a neurosurgeon. So certainly, if you want to be a surgeon or a doctor, you're going to have to work at the hospital. If you like working in big buildings with a lot of people, physicians and nurses and technicians, and there are patients at the hospital too. This is a picture of TidalHealth Peninsula Regional. So this is the hospital that I work at in Salisbury. And if you want to be a surgeon, you're not really going to be in the office very much, which I kind of like. Some people like being in an office where you're sitting at a desk and, talking with patients and evaluating them in an office. And then other doctors enjoy being in a hospital and working in an operating room. So, in an operating room is where you do all your surgeries. But this is a picture of one of our operating rooms here in Salisbury, where we do brain surgeries, not just, with a scalpel and with, drills, but also with catheters and wires. So this is what we call our neurosurgery hybrid operating room. So it has an operating room table, and then it has a big X-ray machine to help us do the angiograms. So just like I showed you that picture earlier, this is, a special X-ray machine that helps us take the angiogram pictures. And, an operating room, it's meant to be very clean. So all of our surgeries are sterile so that patients don't get infections. So that's what our operating room looks like at the hospital. And so, when you're a surgeon, you get to wear funny costumes. But yeah, this is what we look like when we're working in the operating room. So on the left is when I'm doing, a traditional open surgery, with big instruments like a scalpel or a retractor and a drill. We use drills for brain surgery and for spine surgery. But, because everything's sterile, we have to wear a gown and gloves, and we wear a mask and a hairnet. And then to help us see things better, we wear special glasses with little tiny microscopes on them. We call them loops. So that's what I look like when I do a regular type of surgery. And then on the right is what I wear when we do the angiogram and the catheter work, with catheters and wires. Because we use that big X-ray machine, we have to protect ourselves from X-ray exposure. So we wear leaded aprons. We wear a thyroid shield to protect our thyroid gland. We have a badge that keeps track of how much radiation we're exposed to. I wear lead glasses and a lead hat, all for some protection. But that's what we kind of look like every day in our office. So you don't have to wear a suit and tie or a dress, which, to some people is a lot more comfortable and fun. So that's what we look like in the operating room. All right, so just some interesting videos, hopefully most of the students and the kids watching will, it is lunchtime, so I hope most people are okay. But actually, this video is supposed to be a little bit longer, but, I'll point out a few things. So first off, this is the video of the patient with that big brain tumor that I showed you. So actually, maybe I'll go back. So this video that we're looking at is the patient with this brain tumor, okay? That exact MRI. Except now, the tumor is sort of this light gray tissue, and just like on the MRI, it was sort of underneath the brain. So this is the brain cortex. And you can see that that tumor is underneath. So in order for me to do the surgery to remove the tumor, we kind of had to gently retract on the brain and remove the tumor from underneath. But some cool things. So you see that the brain is moving, right? It's pulsating actually. So every time the heart beats, because of all of the blood flow that goes to the brain also pulsates with the heartbeat. So that's kind of cool to see. And then obviously, in order to get to the tumor and to see the brain, we had to remove part of the skull, the bone. So that's already been removed. And then in between the bone and the brain is what we call the dura mater, which is part of the meninges. It's the covering of the brain. So after I removed the bone, I opened up the dura, which is this white tissue that you see here, and I have some sutures that are keeping it held open. So yeah, this is sort of what a typical brain surgery for a brain tumor resection looks like. We call it a craniotomy because the cranium is the skull or the bone, and otomy means you're removing something. So craniotomy means we've removed part of the skull in order to do the brain tumor resection. And then once we're done with the tumor resection, we do put the bone back so that cosmetically, the patient looks normal after we are done with the surgery. So that's one of these videos. So this shows a craniotomy. This video is actually a brain aneurysm surgery. And like I told you, an aneurysm is a bulge on an artery. So this particular aneurysm is quite large. So definitely it looks like an artery with a big bulge. And one of the ways to fix an aneurysm in the brain is to close it with a clip. So again, we've done a craniotomy. These are, this is the frontal lobe and the temporal lobe of the brain. And in order to get to this aneurysm, we have dissected through in between the two lobes of the brain in order to get to the aneurysm. And you see now I'm putting a clip, and it actually looks like a clip. It's titanium metal, and it sits around the aneurysm sac to close it. And I think in this case, we're going to adjust the clips and put multiple clips in order to completely close the aneurysm. And, we're doing it to prevent a bleed because, some aneurysms can bleed in the brain and cause a stroke. So this patient decided to have their aneurysm fixed before it caused a problem. So obviously you're closing the aneurysm, but you also want to make sure that the normal arteries in the brain are not closed or blocked when you put the clips. So after we put the clips, we're going to inspect a little bit and see, make sure that the other arteries are okay. So yeah, this is brain surgery. So you can tell, with brain surgery, the movements are a little bit finer than maybe other types of surgeries that are done. And we use an operating microscope. So the video is taken through a microscope that I'm looking through, not just the glasses, but a big microscope machine in order to do the surgery. So surgery is good for anybody who, likes working in a hospital, not necessarily in an office. You're in an operating room, you work with your hands, you fix problems in patients. So that's what's involved with surgery. And then we're going to show you, the next video is going to show you how we fix aneurysms in the brain without a scalpel, without making a cut on the head, without doing a craniotomy. So this particular type of surgery is done with catheters and wires through the blood vessels. So it's just a needle stick at the top of the leg. There's the femoral artery, which is a big artery at the top of the leg. And we go in with a little needle, and then we track our catheters all the way up into the brain. But this is the angiogram picture I showed you. So on the left is a picture of the aneurysm before we fixed it. And then on the right is after we filled it from the inside with coils. So instead of putting clips from the outside, we do a procedure where we track a catheter all the way up into the aneurysm, and then we fill it with what we call coils in order to block the blood from getting in. And once the blood can't go in the aneurysm, then it'll never cause a stroke or a problem for the patient. So this is a video of that surgery. So, when we do an angiogram, when we do the surgery with catheters and wires, we use the X-ray. So that's why it looks a little bit different from the other surgeries. So I wear, all the lead apron and the lead glasses, because we're using the X-ray. And you can see now there's a catheter in the aneurysm. And then we're deploying or putting a coil into that bulge in order to close the aneurysm. So again, it's a different sort of surgery. It's more minimally invasive. It's different techniques. Small movements again, in the brain, everything is a little bit more delicate and fragile. So we take our time, and that's what that particular surgery looks like. So yeah, surgery, is very broad too. We don't do exactly the same thing every day. Every patient's a little different. The surgery that we do or the technique that we use is going to be a little bit different from patient to patient. So there's still a lot of variety in what we do every day. And I think this is one of the last cases I was going to show, but it's a very dramatic picture. But again, these are angiogram pictures, so taken with the X-ray and with contrast dye. So this blood vessel or artery that I'm pointing at is the internal carotid artery on the left side of the brain. And the carotid arteries, they come off the aorta, which is part of the heart. So the aorta is that giant artery in the body. And then there are some arteries that branch off of the aorta, including the carotid arteries, which travel up the side of your neck. And they go all the way up to the brain. That's why the carotid arteries are so important, because they are one of the main blood supplies to the brain. So in this patient, you can see on the left here, the carotid artery, once it gets up into the head, is completely blocked. So this is a major stroke in a patient where one of the main arteries, the carotid artery, on the left side of the brain is blocked. So that entire part of the brain on the left is not getting any blood flow or any oxygen. So this patient needs help urgently. And the left side of the brain controls the right side of the body. So, they came to the emergency room because suddenly they couldn't move their right arm, their right leg. They had trouble speaking and talking. So we knew right away there was a problem with the brain. And when we did the angiogram, we saw the blockage. And what we did was we did a surgery with catheters and wires, where we placed a catheter. You see this catheter here? At one point, it was all the way up here, and we applied suction or aspiration through that catheter to remove the blockage. And once that blockage was removed, you see that all the blood flow returns to the brain. So it's a pretty dramatic and impressive, picture to see that, somebody has a serious problem, a major blockage in the carotid, and we're able to do a surgery to remove that blockage to help them get better. So again, another type of surgery that we do. So yeah, those are the main slides that I had. We have a few minutes, and I'm happy to take any questions. I'm sure maybe a lot of you have some good questions for me. So yeah.
All righty. Nicole, do you want to? I've got a question of my own, but Nicole, let's get some of the student questions in
yeah.
first.
I'll definitely start with the more clinical questions because I know you're short on time, Dr. Shakur. So, first question, how do brain tumors form?
Yeah, so it depends on the type of brain tumor. So, the biggest categories would be benign versus malignant or cancerous, right? And then the other has to do probably with the location in the brain where the tumor forms. Uh, so, tumors are really growths. In other words, there are cells that suddenly start to grow a lot, and then they form a mass, and that's what we call a tumor. So just like in other parts of the body, there might be a particular type of cell that suddenly, for some, usually it's a genetic reason, where, the genetic mechanism that controls cell division and, when a cell or a mass stops growing has a problem. So most tumors have usually really a genetic problem. But, if you have a meningioma, that genetic problem in the cell probably happened in the meninges of the brain. And so that's how you ended up with a tumor in the meninges and a meningioma versus a cancerous tumor like a glioblastoma. That probably has a different sort of genetic basis and cause. It's a different cell type where that process started. But the whole idea is a tumor is a growth, and it's really a problem with the genetic mechanisms in those cells that caused it to suddenly divide and not stop.
Yeah, thank you. We also have some questions about the length of surgeries, which I'm sure varies. So I guess I'll reword it as, what is the shortest surgery and then the longest surgery you've done?
Well, the shortest procedures that I probably do are the angiograms. Sometimes we do the angiograms not to treat anything, but simply to do the study and to take pictures. So a procedure like that might only take 20 to 30 minutes for the actual procedure time. And then, yes, some brain surgeries especially can be longer. So that tumor surgery, the meningioma that I showed you, took several hours to do. So yeah, as a surgeon, it's enjoyable work, but yes, it is somewhat physical, and you have to have pretty high endurance to be, focused on a particular task or problem for several hours. So, you're talking maybe more than 5 hours, 7 hours. Those are probably, the longer surgeries that we do would be several hours.
And with those that are several hours long, do you get a chance to like tap out for a minute? You're like, I'm gonna pass out, or like, how does that work? I'm sure students would be curious to know.
Yeah, I mean, if you really need to take a break, then yes, the patient is stable during the surgery. So, during most surgeries, including that tumor surgery I showed, we do not take breaks. However, yes, if you really need to take a break, use the bathroom, something like that, then yes, the patient is stable enough for you to leave. And, there are lots of people in the operating room who can keep an eye on the patient if you really need to step out.
Did you want to ask your question or should?
Sure. So, along with a lot of other things we've heard about Elon Musk recently, one of his more interesting ventures is Neuralink. And I wondered if you had been exposed to that at all, had any thoughts about its potential for the future?
Well, yeah, with all the technology, especially within healthcare, and, neurosurgery, a lot of things are changing. There's AI technology and so, some of the newer technologies and treatments, they still go through a pretty rigorous process before, we start using that in everyday patients. So, at most hospitals, patients and surgeons are still not working with that technology yet. So I have not seen that myself. There's also technology which seems very promising. It uses AI technology to help patients walk again. In other words, there's an implant that goes on the brain and it can communicate with wires that are attached to the spinal cord. Because, in a lot of people who are paralyzed, there's a problem with the spinal cord. And so the signal from the brain to the spinal cord doesn't get there normally. But with this particular technology or device, it sends the signal through the wires, through the implanted computer, so that the person can control their legs and walk. So, yeah, it takes a long time, even though it sounds very exciting, and hopefully it is right around the corner. It still goes through a rigorous process before we really use it.
We do have thumbs up. We do have quite a few questions about your educational journey to become a brain surgeon. So I
Sure.
guess we'll kind of, if you want to just kind of talk through about like, I got my bachelor's in this, or I went to medical school here. This is how I decided I want to be a brain surgeon, those kind of things. We have a lot of questions about that.
Yeah, sure. Uh, so yeah, I'm actually a local person. So, I went to school at Pinehurst Elementary in Salisbury. And then I went to Bennett Middle and James M. Bennett High School. Uh, and then, I didn't want to go too far from home, so I went to Johns Hopkins for college and for medical school. So I was in Baltimore for 8 years. So, college is 4 years, and then medical school is 4 years. Uh, and then I did my neurosurgery residency, which is about 7 years after medical school. Yeah, I went to Chicago, so the University of Chicago. And then in order to do the angiogram type work, so the blood vessel surgeries, you have to do a fellowship. In other words, even more specialized training, which took about an extra year. So that was 8 years after medical school. But, time flies when you're doing things that you enjoy. And, obviously you're with a group of residents, you're always with other students who are learning. So it's a lot of fun. Now, how did I decide on neurosurgery? So, some young people kind of know very early on what they want to do. I did not decide on neurosurgery until I was already in medical school. Uh, I always kind of knew that I wanted to be a doctor. So, even let's say in middle school, I always liked math and science a little bit more than history or English classes. But so I liked the math and sciences. And you can shadow. I volunteered at TidalHealth when I was in high school, and they let me rotate in a few clinical parts of the hospital. So you could see up close, what a hospital is like, what different parts, different people in the hospital do, if you're interested in a career in healthcare. And then certainly in medical school and college, again, you can contact a doctor in a hospital. I ended up seeing Parkinson's disease surgery at Hopkins when I was when I was actually a college student. And so who knows? I mean, maybe that kind of triggered neurosurgery in my mind. But yeah, you're sort of a math and science person to start. And then sometimes you kind of know that, you like working with patients or doing procedures. And then you decide if you like surgery versus internal medicine specialties, which are more office-based. So that was my career path.
What did you do for your bachelor's?
Yeah, I majored in biology.
Okay.
So, to become a doctor, you don't necessarily have to major in a math or science. I always enjoyed biology. So, your question about, how do tumors form? I had to think back to my to my bio classes, but yeah, I always really liked biology. But yeah, you can major in anything, but you still have to do a core group of courses, to
Right.
go to medical school.
So I know we only have a few minutes till you got to go to your next surgery. So I guess the last question I'll kind of leave you with, because there's a few of them, is do you have any advice for aspiring brain surgeons or people who want to go to medical school, kind of what they should be thinking of, any extracurriculars they should be thinking of, that kind of idea?
Yeah, I mean, there's so much, right?
Yes. Yeah.
Unfortunately, this kind of career path, it's more competitive than I think it needs to be. So, if you're a student, who's interested in medicine or becoming a doctor or doing neurosurgery, you really have to work pretty hard. Even in high school, anything that can give you some experience at a hospital or working with a doctor or working in a research lab, you have to really be pretty motivated and focused and hardworking. Nothing ever comes easy either. So you have to have that mindset too, that you're not going to give up. In other words, you're going to make a decision, you're going to stick to that decision. And, if you come across, a challenge, you're up to the challenge. So, but it's certainly rewarding. So you won't be disappointed. But in general, right? I mean, I just tell students to pick what they really like because, if you're going to be good at anything, whatever you choose, you're going to have to work hard at it anyway if you're going to be good. So you might as well pick something that you really enjoy.
Right.
But yeah, I mean, there's so much advice, but the main thing is, you got to be highly motivated and persistent, uh, and take every opportunity. For example, when I was in, I think, high school, it might have been the summer after senior year of high school, and I don't know if they still do it, but the NIH, the National Institutes of Health in Washington, D.C., they had a summer research program for students. And I ended up doing a summer there. I worked in a neurology lab.
Okay.
Where they were testing, medications for seizures and for epilepsy. And then I think I worked in the same lab the following summer. And then certainly any opportunity where you can volunteer at a hospital or shadow a doctor when you're in college or medical school, all of that is really important to make yourself competitive.
Yeah, thank you so much. I know you gotta run out, but we really appreciate
Yeah, I'm happy to take a couple more questions if you,
Okay. All
yeah.
right. We just weren't sure because I know you had a hard stop at 1, so we wanted to make sure you get out of
That's
there.
okay. Yeah, we started a little late, so certainly
Okay.
if you have a couple more questions.
Okay. Yes. So there are questions in regards to I think we had a pretty early question. It was saying can mental illnesses affect the way the brain looks?
How it looks.
Yeah.
Yes, so even though, if you Google or Wikipedia, a picture of the brain, and all brains kind of look the same, right? Grossly to the naked eye. There have been studies that look at, the brain more microscopically, uh, and, even in terms of pathways and how it's wired, certainly is going to be different from person to person. So yes, for example, the easiest way to maybe explain is, there is something called a functional MRI.
Mm-hmm.
So it's a special MRI where during the MRI scan, you're having the person do a task. For example, maybe they're looking at happy images, or maybe they're looking at sad images to see what parts of the brain light up. And, it's pretty well known that, if you have depression, for example, different parts of the brain might, appear a certain way, for example, on a functional MRI. And the same goes for maybe microscopic anatomy too, where from person to person, uh, it's a little bit different. Certainly with mental illnesses or other things too. So yes, there are differences.
Yeah, and then on that same breath, we actually had a couple questions about how is, I guess, your mental health or other peers that you have in being a neurosurgeon. How do you manage what you're doing and taking care of yourself at the same time?
Yeah, that's a great question, and actually, it's pretty relevant because these topics are even discussed at our national meetings. So we have a national meeting coming up, and there was a student who reached out to me, a medical student, who asked me if I could be on the panel to talk about this topic. But yeah, it's very important. So, also it kind of ties into how you pick your career. So, it's sort of important to know yourself, right? Certainly, brain surgery, neurosurgery is what some people consider a stressful job. Uh, Personally, I don't feel stressed with it. It doesn't stress me out. But it's probably because I picked a career that I was probably really meant to do. So, if you, like I said, if you pick something that you really like and that you can handle every day for, many years, then I don't think you're going to feel stressed by it. Uh, now, yes, I've seen colleagues who certainly do get stressed with it. And, you definitely have to take, in those cases, if you feel stressed, then yes, you have to have a routine where you set aside time for yourself, where you can, take a breather and maybe step away from the everyday of neurosurgery that we're exposed to. Uh, but yeah, even with our job, we're not always doing our job. We have days off. Okay. I mean, it's just like any job where, yeah, you could do it where you work only 40 hours a week, let's say. Uh, but, um, but yeah, it's still a work-life balance, and certainly any career that you pick, you should not forget that part of it, the
Yeah.
work-life balance part. Hmm.
Do you have time for one more question?
Oh, yeah, sure.
Okay. So we're talking about the more work-life balance, but in regards to work, there was a couple questions about what a typical day looks like for you or a typical shift. Like how long is that? How many people do you see? How many surgeries do you perform? That kind of thing.
Yeah, so it still varies from neurosurgeon to neurosurgeon. So for example, I have a friend in North Carolina and she's a neurosurgeon and she actually doesn't take call on any weekends. And I don't know how she managed to arrange that at her hospital. But yeah, so for example, like today, I have 2 surgeries. And each surgery is probably only a couple hours long. So, today is considered a pretty good day. In other words, I'm definitely going to be done before 5, and I got to the hospital around 8 this morning. So, surgeries usually start early in the morning, 7:45, 8 in the morning. And if they're not too long, you'll definitely be done by 5. And in general, it's a Monday through Friday job. We do take call, because people might need brain surgery at any time of the day or night. So that's what we mean by when we take call. So I have 3 colleagues, so we have to take call once every 4 days. So I'm on call today, but then I won't be on call until Friday again. And call means that, I can be at home, but if somebody calls me from the emergency room, I have to be available to respond to them. And again, that's not every day and it's not every weekend. But yeah, neurosurgery is mostly sort of a, 8 to 5 job, Monday through Friday, with some call intermittently within that time.
Thank you. Tim, do you have any questions that you would like?
No, I
Okay.
think we're probably, however, at a good stopping point here. Doctor, thank you very much for your presentation.
Thank you so much.
And
Yeah,
coming from and returning to surgery.
Yeah.
Folks, next week we're going to be doing nursing with BB Healthcare. Have a great week and we'll see you next time. Take care. Bye-bye.